So this is chapter 14, and we're talking about different communicable diseases and infections. Uh, Methicillin-resistant Staphylococcus aureus, also known as MRSA, it causes infections. The big problem is that it's resistant to the antibiotics that we typically use to treat those infections. In healthcare settings, MRSA is transmitted from patient to patient because of us, because we don't wash our hands enough. And so patients end up getting it. A lot of times, we as healthcare providers don't end up getting MRSA infections because a lot of times our immune systems are adequate enough to fight it off, but we do end up taking it from patient to patient. Studies have shown that 5 to 15% of healthcare providers carry MRSA in their nose, and then can be transferred to the skin and other areas through a break in the skin. So keep that in mind. A lot of us actually have it, but we need to be very careful with our patients. Factors that increase the risk of MRSA infection include those that are on antibiotic therapy, those that have prolonged hospital stays, those that stay in an intensive care unit or a burn unit, and if they have exposure to another infected patient. MRSA typically results in soft tissue infections, signs and symptoms, localized skin abscesses, and then sepsis in older patients. Some global health issues, MERS-CoV, which is Middle Eastern Respiratory Syndrome coronavirus. This is a virus that is found in animals in the Middle East. However, there has been human cases now. The first one appeared in Saudi Arabia in 2012. Most of the infections are found over in the Middle East. However, there have been some cases that have been found in Europe and the United States. Common symptoms include high fever, cough, muscle aches, vomiting, and diarrhea. In some cases, the patient may progress into renal failure, respiratory failure, and death. At this time, there's no cure or vaccine for the virus. If you suspect that your patient may have this, then you want to place a surgical mask on the patient and notify the receiving facility. Ebola is something that's popped up in the last couple of years. In 2014, there was an outbreak of the Ebola virus in West Africa, which spread when infected people traveled to other countries, which caused international concern, obviously. The incubation period is 6 to 12 days after you're exposed. However, symptoms may not appear for as long as 21 days after infection. Symptoms include watery diarrhea, vomiting, fever, body aches, and then just bleeding. Fatality can be as high as 70% if they don't get prompt treatment. If you suspect Ebola, place a surgical mask on the patient, follow PPE as outlined in your local protocols and the CDC, and then make sure you notify the receiving facility. Travel medicine, you need to be aware of the fact that patients may have contracted something that's not popular where you live because they have recently traveled outside of the United States. Patients can present with a wide variety of symptoms, can be fever, cough, vomiting, bloody diarrhea, body aches, rashes. Some patients may experience just kind of mild symptoms. Others may be extremely ill. When you encounter somebody that has had recent travel, just place a mask on them and then gather as much information as possible. You want to be proactive in keeping yourself safe. Some important questions to ask is, where did you travel? Did you receive any vaccinations before your trip? Oftentimes when you're traveling outside of the US, depending on where you're going, there may be required vaccinations. Were you exposed to any infectious diseases? They may or may not know. Is there anybody else in your travel party that got sick? What types of foods did you eat? And what was your source of drinking water? If you suspect the patient has a communicable illness, follow your appropriate PPE precautions and make sure you notify the receiving facility as well. So The assessment and treatment of medical patients can be very challenging just because medical conditions tend to intertwine with each other, or a lot of them present with very similar signs and symptoms. And so you're going to have to ask a lot of questions in order to narrow things down. When you're treating medical patients, you start with a big, broad idea of anything that could be causing those patients' symptoms, which is called your list of differential diagnoses. And then you're going to use your physical exam and your other assessment tools to start checking off those things. You may not come down to, yes, I know for sure this is exactly what's going on with my patient, but if you can take off some things of, yes, my patient definitely doesn't have this, my patient definitely doesn't have that, and you start with the most life-threatening and work your way down, you're going to be better off. There's often times that we have no idea what's exactly going on with our patient, but if we can rule out some of those life-threatening things and then come up with the appropriate treatment, typically that's going to be what we have to do. This is the last recording for 14.